gallbladder and everything like that. So now no rebound tenderness. So I can do push kind of hard and then let go. Did that hurt? Did you feel any tenderness? And the same thing here. No, good, I'm sorry. Because that can be indicative of like an appendicitis. You can also have, lift up your leg for me, and then you don't feel any pain in that lower quad. Good. So that means right there he shouldn't be having an appendicitis or anything like that. So upon the light palpitation, he had no tenderness, and the bladder, there were no masses, it wasn't distended or anything, and on rebound, there was no tenderness or anything specifically, like I said, to that right lower quad. And then the percussion on his liver and spleen, there were no abnormalities noted. And I had auscultated his abdominal aorta, his iliac, and his femoral vessels. And then I did not hear any bruits or anything like that, which is definitely good. I'm gonna go ahead and, can you bend this leg for me and then just straighten it and then straighten it and put it back down? No pain, nothing like that. So he has bilateral movement on each leg or anything. I can also do push against my foot bed. Okay, do you have any pain, tenderness, or anything on your calf? Okay, that's good. That is a negative Homan sign, which can be indicative of a DVT, which is a deep vein thrombosis, which he did not feel. And then I can also, well, he wouldn't have shoes on normally, but I could be feeling for his pedal pulses, and both of them are active, regular, and both even, as well as posterior tibial pulses, and those are good, and those are on the inner aspect of his leg. And then also popliteal, which is behind the knees, and then femoral, and we had felt there, and that was good, and he didn't have any pain or anything like that. While I'm up here, I would feel on each side, always comparing two sides, his radial pulse, also brachial. We did your carotid, so that's good. Let's see. I didn't hear any wheezing or anything like that with your chest or anything, so that's good. I did note your ratio 1 to 2. Okay, no use of accessory muscles when you're at rest or upon exertion or anything. You did have a gag reflex, which is great. Your hearing test, we do 3 tests, the whisper test, and this is like, can you hear this good? And how about here? Okay. And the Rhine and Weber tests are 2 additional hearing tests, and one, the Weber goes up here. It's like a tuning fork, and then you put it here, and then you ask him, can you hear equally? And then you would normally say yes. And then the Rhine test is a bone conduction versus air conduction, and you would hit the tuning fork, and then you would put it on his mastoid, and he'd be able to hear that. And he'd still be able to continue to hear that whenever I moved it away and just put it to the side, which in all actuality that is correct, because air conduction is louder than bone, excuse me, bone conduction. And he was able to hear that good. He's got adequate capillary refills. I was able to auscultate and hear S1 and S2 audibly with no murmur detected. Mid-clavicular line to the 4th intercostal space was his apical pulse, and I did have him turn as well so that I could hear that valve close. Symmetrical, everything seems to be intact with him. He's awake, he's alert, he's oriented. His speech is clear. He was able to answer my questions appropriately. I think the only thing is that I had needed you to, let's see, I don't know what I did with my little test, my eye test, but just say that this is our eye chart, okay? And I want you to hold this about right here and read to me the smallest line you can read. Just say like if it was BAG or something like
smallest one?
Yeah.
BAG.
Okay, good. And so that would be, yeah, indicative of 20/20 vision, which is good. His conjunctiva is clear, the sclera in his eye is white with normal blood vessels that you can see, free from any foreign body or anything. There was no no tenderness or anything upon palpitation of his lymph nodes. His teeth are functional, they're intact. His uvula did present the gag reflex, which is what we want to hear. He was able to hear with the Weber-Rhine and whisper test. Your ears are symmetrical. Nothing seems out of place, which is good. You were able to move all extremities without difficulty. He did walk with a steady gait, and for his age, that's appropriate, considering he doesn't have a health history problems. His carotid was good. It was equal, strong, no JVD distension, which is good. And bilaterally, that was noted. Let's see your spine, your chest, yes. Your trachea was midline, symmetrical, no problems there. Was able to hear air movement there. Normal fremitus whenever I palpated, and at your second intercostal space upon percussion, I was able to hear a normal tactile fremitus, and your expansion was good bilaterally whenever you took in a breath. Your abdomen good, soft. I was able to hear all four quadrants. Liver and spleen were good, your heart were good, negative Hohmann sign. Let's see, you basically are a very healthy young man, and I just want to let you know the importance of, the doctor's going to come see you and finish his examination, but as far as my examination goes, that I am done, and you did great, and I don't see any problems that you have physically or mentally, and but the importance is to get an annual checkup, each year, okay? And I want you to be able to, if there's any problems or questions or anything, you can always call or come back. But I mean, if you don't have nothing changes, then you can come back in a year. But I really do appreciate you being my patient for this, and I apologize if I was kind of hard to hear. I'm just getting over pleurisy, and I've been out of work for 10 nights, and tonight was my first night back. But that was my head-to-toe assessment, and I hope y'all enjoyed it. And Brandon, again, thanks so much.
Thank you, Nurse V.
All right.